One of the difficult things about hip dysplasia is it's pretty silent, and there are not really good ways to detect it except by x-ray, and we can't really take an x-ray of everybody. So the more severe ones, you're going to see it. There would definitely be a limp would be the main thing, but pain doesn't occur until a much older age group, like 13 or 14 years old or even older. To detect it for your child, a lot of children walk funny and they trip and they stumble and all those things. And so unless it's pretty extreme, or unless your pediatrician's worried about it, your child's safe from hip dysplasia. Now, if you really have a high concern about it, or you've got a family history, or you had a breech baby, or you're really swaddled tightly, then an x-ray is not necessarily a bad idea, and that can definitely make the diagnosis. Well, there are, of course, a lot of things that can cause hip pain in a teenager, from just sports injuries to other things, but hip dysplasia can begin to hurt around age 13 or 14 because of early arthritis, and it can be undetected until that time. Now, if it does, then that's a time you definitely want to get an x-ray, go to the doctor, and there's some treatments for it, mostly surgical treatments, but if you act, even in a teenager, you can restore the hip to pretty normal function. How to know what to look for in a doctor is always a tough question. And I think you'd certainly want a doctor who preferably has some experience with the condition and who can explain and interact with you well. But I think parents should not be afraid to ask a physician, what is your experience and what's your training, and how much of this hip dysplasia have you treated in your career? Those are fair questions to ask doctors. The Pediatric Orthopedic Society of North America has a listing of physicians, and you can go on their website and find physicians who specialize in pediatric orthopedics. Now, some of those doctors may specialize in other areas of pediatric orthopedics, like fracture care or foot or something like that. So even though you go to that website, you'd have to ask the individual doctor what their experience is with hip dysplasia. The good news is that almost all pediatricians are very well trained to examine for hips, and they understand they have to examine the baby's hips every visit, at least for the first year of life. So that's one thing you could just simply remind your pediatrician, how are my baby's hips, and those kind of things, so that you make sure that he does check for them. Parents can definitely come to our website at www.hipdysplasia.org and find out a lot of information about hip dysplasia. And if they want to, they can contact us and we'll send them more information, or they can ask questions if we haven't answered all their questions.